PTSD, or post-traumatic stress disorder, results from exposure to a traumatic event, causing emotional distress and various symptoms. The American Psychological Association's DSM-5, described in Dr. Durant's textbook, outlines these symptoms. Yet during the 2004 Indian Ocean tsunami in Sri Lanka, these symptoms weren't the same. Sri Lanka, off the southern coast of India, with its community-based values and adherence to religions like Hinduism and Buddhism, faced challenges in addressing PTSD. In Crazy Like Us by Ethan Waters, psychologist Deborah Wentz' first-hand experience with PTSD triggered by the tsunami in Sri Lanka led her to advocate for change in diagnosing and treating PTSD.
A well-intentioned effort by Wentz used city officials and news outlets to encourage Sri Lankans to seek professional help. However, the community faced challenges in seeking mental health support due to the cultural values that prioritize religious beliefs and community bonds. Gayatri Fernando, studying the aftermath of the 2001 earthquake, observed that westernized diagnosis and treatments were deemed ineffective. When Fernando was diagnosing PTSD in Sri Lankan communities, she was informed not to say that the tsunami was bad or mean, because in Buddhism, the tsunami was considered karma. Instead of solely focusing on psychological trauma, Fernando recognized the sociological issues, such as the loss of status and meaning within the community. When Fernando asked an 8-year-old boy what makes him feel better about the violence in his community, it was that his mother didn't promise him safety, but rather to die together as a family. The in-post-etic perspective, as per Rogoff 2003, occurs when psychologists apply their own cultural understanding to clinical questions and treatments without considering the client's cultural context. In contrast, psychologists like Fernando, utilizing the derived etic perspective, immerse themselves within the cultural community. She avoids asking about tsunami-related PTSD symptoms, but asks what was an impactful event in their life, and the majority of them said the tsunami. In contrast, once influenced by westernized PTSD treatment, led Western psychologists to Sri Lanka, assuming one-on-one therapy was universally effective. This approach proved ineffective due to a lack of cultural sensitivity and understanding of sociological issues in Sri Lankan communities.
In comparing PTSD in Western and Sri Lankan cultures, Westernized societies prefer individual treatments like one-on-one therapy. However, the community-based nature of Sri Lankan culture makes such treatments feel dishonorable and uncomfortable, as they prefer addressing PTSD collectively. While Western cultures view PTSD as primarily emotional and psychological, Sri Lankans experience more somatic symptoms like chest and stomach pains during tsunami flashbacks. While PTSD in Sri Lanka may have received a diagnosis similar to the DSM-5 and other Western psychological standards, effective treatment differs. Sri Lankans require a therapeutic approach rooted in community understanding to achieve somatic closure, distinct from the therapy-centric or time-off approaches common in Western cultures. While implementing a derived etic perspective can be challenging, recognizing the need to avoid an imposed etic perspective is a crucial step in acknowledging diverse mental health treatments across cultural communities.